Good afternoon. Today is Tuesday, May 11th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me today are Jodi Martin, Supervising Public Health Nurse of Preventative Services, and Diane Oldenburg, Senior Public Health Educator, both with the County Health Department. Our 7-day positivity rate has gone down to 2% this week from 2.3 last week. Our community transmission rate has also lowered to substantial, according to the CDC. In theory, this is good news, but it demonstrates the fluctuation we've seen in recent reports. We must remain steadfast as we work to get more people vaccinated, reduce community transmission, and overcome this disease. With vaccinations being key to that success, the FDA announced yesterday it has expanded emergency use authorization of the Pfizer vaccine to now include youth aged 12 to 15. This is an important step as we move towards achieving herd immunity. National, state, and local data all show a shift toward more younger populations getting the virus rather than older populations. This is because more older people are vaccinated than younger people are, and it is evidence of the vaccine's effectiveness. If you are eligible to receive the vaccine, please make an appointment today to get vaccinated. The COVID-19 vaccine will protect you and your family from the virus. The Health Department is hosting another mini clinic scheduled for Saturday, May 15th from 11 to 11:30 at the G. Ray Bodley High School in Fulton. The Johnson & Johnson vaccine, which only requires one dose, will be administered. For more information about COVID-19 vaccines, go to covid19vaccine.health.newyork.gov and click on the fact sheet link for each one. Registration links for vaccination clinics are posted on the Health Department's COVID-19 vaccine page. You can also call the Oswego County COVID-19 hotline from 8:30 a.m. to 4 p.m. weekdays for help in making an appointment. Dial 315-349-3330. National Nurses Week continues through tomorrow, and I'd like to take a moment and thank our nurses at the Health Department, at the county jail, and at the healthcare facilities across the county for their hard work and dedication, and especially for the sacrifices they've made to take care of us through this pandemic. Today, Jodi is here to give us more information about the county's healthcare services.
Thank you, Chairman. Public health nurses make up the largest group of public health professionals in New York's local health departments. They work with individuals, families, and groups to improve the overall health of communities. Our public health nurses are a valuable resource and critical link with the community. They bring healthcare and education into the community and return with important information the health department needs to better serve the public. In addition to battling COVID-19, Oswego County's nursing staff provides core public health services such as immunizations, disease surveillance, lead poisoning prevention, and home-based health care to residents of Oswego County through programs such as Healthy Families Oswego County, preschool special education, maternal child health services, personal care assistance, and hospice care. Working with residents, we have noticed that some individuals may have been reluctant to sign up for COVID-19 vaccine because they don't have health insurance. I want to reassure residents, first, there is no cost for the vaccine itself. Second, while there is a small admin fee that gets billed to health insurance, no one will be turned away for the lack of insurance or the inability to pay. The Oswego County Health Department has provided healthcare services to residents for over 40 years. It is committed to the principle that a healthy population is a necessary foundation to a healthy community. And now I'll turn it over to Diane for the latest COVID-19 report. Thank you.
Thank you, Jodi. As of this afternoon, we have total active positive cases of 169. Total tests returned are 209,975. We have cumulative positive cases of 7,887. Total negative results are 199,320. Total patients released from isolation, 7,628. And we have 90 deaths reported due to COVID-19 from the New York State Department of Health. Total residents in mandatory quarantine or isolation is 505. As of today, 43.7% or 51,501 Oswego County residents have received at least one dose of vaccine. 44,168 residents have completed the vaccine series. In the 65 and over age group, our vaccination rate is 77.1%. That is higher than the state's rate of 75.2% for that age group. Local data shows that the COVID-19 vaccine is working. It effectively protects seniors from death. From the start of the pandemic, the county's average age of death from the virus was 82. When vaccinations started, they were prioritized for seniors first. Since April 7th, we have not had a death from the virus. It also shows that the average age of new positive cases has shifted to the younger population since vaccinations started. The age 66 and above group went from 17% to 5%, while the 19 to 44-year-old age group increased from 39% to 49%. As the chairman said, vaccines are the key to getting through this pandemic. The more people we can get vaccinated, the closer we can get to herd immunity, and the sooner we can get back to normal. If you're eligible for the vaccine, visit the health department's COVID-19 vaccine page and click on the link to make an appointment. If you don't have a computer or internet access, call the county's COVID-19 hotline for help in making the appointment. Dial 315-349-3330. As Jodi said, if you want to get vaccinated but do not have health insurance, please register online or call our COVID-19 hotline to make an appointment. We will vaccinate you with no out-of-pocket expense. The vaccines are safe and effective. They prevent severe symptoms, hospitalization, and death. It is important to know that serious side effects are rare. The Oswego County Health Department has administered thousands of doses of vaccine with no reports of severe adverse reactions. Some residents have reported no reactions at all, while others have reported common side effects such as sore arm, fever, fatigue, or nausea. Still, if you have questions or concern about the vaccines, call your doctor or the county's COVID-19 hotline. We are all available to help you. Regardless of your vaccination status, remember to be proactive and responsible about preventing the spread of the virus. Practice the 3 W's. Wear a mask, watch your distance, and wash your hands frequently. Thanks.
Thank you, Diane. New York State continues to loosen restrictions. Racing venues were allowed to open at 20% capacity on April 22nd, and racing at Oswego Speedway has begun. Graduation ceremonies are now permitted with limited capacity. Effective Saturday, gyms and fitness centers will be able to increase capacity to 50%. The curfew has already been lifted. Starting next Monday, bars and restaurants may keep their outdoor dining areas open after midnight. The state has also adopted the CDC's mask guidance for fully vaccinated people. They can now participate in outdoor activities or gatherings without wearing a mask, except in certain crowded settings such as parades, concerts, sporting venues, and other similar situations. I encourage you to keep checking the New York State website to keep up with the latest guidance and updates. On the county government level, Oswego County Workforce New York is hosting another job fair. It is scheduled tomorrow from 1 to 4 p.m. at the Career Center in Fulton. May is also National Foster Care Month, and the Department of Social Services is looking for foster parents. It is hosting a virtual meeting next Monday from 2 to 4. Call 315-963-5382 to sign up. The broadband internet study is still open. Go to cnyinternet.com for more information and to answer the 5-minute survey. If you don't have access to the internet, call 315-412-5966 to request a survey. Please also don't forget that the New York State burn ban remains in effect through Friday. There is more information about these programs on the county government website at oswegocounty.com, along with the latest information on COVID-19 clinics and testing. I encourage you to check back frequently as things continue to open up. Thank you for doing your part to keep our community safe and to help us get through this pandemic. Don't forget to thank a nurse today.